Couple of seconds for it to go live. Very good. So we'll thank you everybody that has joined for our wonderful town hall. We will begin in a couple of minutes. We're going to give people a couple of seconds to join, but we're really excited to have Dr. Eric McDonald on to chat with us about COVID-19 safety and vaccinations for our students. As we're going through our webinar, please feel free to use our Q&A feature. We will be monitoring that section and answering questions as we go along. All right. I seem to have gotten kicked off. Sorry about that. Oh my gosh.
Okay.
Okay. We will, it seems to be better now. All right.
Yeah, Janae, I think the connection is better where you are now than the other room. That was a different room, it looks like. Better connection is, maybe that's what it is.
Yeah, I'm gonna, sorry everybody. It is, as you know, technology is, all right. I was trying to have a more attractive setting, but it is not going to happen.
That's okay.
This is how casual this conversation is going to be now.
Yeah, that's right. Especially when it comes to like family and school, and usually kids are running around and stuff, so it's very appropriate.
This is very appropriate. This is very appropriate. So once again, thank you everybody for joining us for our second COVID-19 town hall, discussing vaccination safety for our kids, and also keeping our kids safe while they're going back to school. So just a little bit about our organization. Northern Virginia Family Service is a leading organization in Northern Virginia that helps our disenfranchised, our at-risk populations. And one of the missions we have come in to taking on is COVID-19 messaging. So we are here in now our 4th month of doing vaccination messaging and reaching out to our Latinx and African American and Asian communities, making sure that we all have the needed tools and the needed messages and to be properly informed about COVID-19 and vaccinations. So my name is Janae Padmore, and I am the project coordinator for COVID-19 vaccination messaging with Northern Virginia Family Service. And we are in partnership with Kaiser Permanente to remove the fear and anxiety from our communities regarding COVID-19. So I will now turn it over to our Dr. Extraordinaire, Dr. Eric McDonald. Would you like to introduce yourself, sir?
Sure, Janae. Thank you very much for the very kind introduction. Well, I'm Dr. Eric McDonald, and I'm happy to be here with you all today. I'm also a father. I have 3 children. I have a son that's 10 and twins that are 8. So like everyone else, I'm also very concerned about COVID-19 effects on my family as well as on myself. I've been an emergency medicine doctor for several years, for over 22 plus years. I spent, actually, first off, I trained. I went to med school at Wright State in Dayton, Ohio. Went to Brown University for undergrad, and I did my residency at King Drew Medical Center in Los Angeles. That's when I did my 3 years emergency medicine training. And then I spent 9 years in the Army. I was an Army physician. I spent time stationed in Hawaii as well as Germany. I was in Germany for 5 years, and I also did a tour in Iraq, doing back in 2003, as well as Kosovo and Pakistan. I've been with Kaiser for 6 years. I was at Southern Maryland Hospital Center for 9 years before that. So I've been around a lot of different places. And I've also been here since the beginning of the pandemic. So a lot of my experiences will be as a frontline physician, as well as a father, and just handling the pandemic from that perspective. One of the things I would say for sure about this pandemic is that as time has evolved, I'm sure all of us, get to a point where we get very fatigued. We get pandemic fatigue. And that's when you just get tired of doing the same things you were doing before. You get tired of the mask. You get tired of having to social distance. You get tired of not being able to see your friends and family. But this is a very important part of it. And really the time when we have to be more vigilant. So it's very tricky. As a healthcare provider, I've also had to care for, patients throughout this whole pandemic. And that's also very taxing. It's very challenging because oftentimes early on in the pandemic, before vaccines, there was a fear of myself getting sick, as well as my patients getting more sick. So COVID-19 is definitely something that we can guard ourselves against, and that we have some things that have available to us that we didn't have available to us initially. But it's also something that we have to also respect and not treat it like COVID-19 is not our friend. Okay, it is not designed to help us at all. It's trying to hurt us. So we have to do what we have to do to protect ourselves. Part of the pandemic that I wanted to discuss as well is just caring for the patients on a daily basis. The more cases that we see nationwide, especially in our communities, then the more virus that's present and the more we have to be cautious. That's what makes it very challenging. Often early on, we would have patients coming in, and they would be lined up outside, and we had to design a separate process for testing patients as well as for treating those patients. So that's very taxing, and it's also very challenging for a healthcare community to really accomplish. Part of that is also to keep patients safe who don't have COVID symptoms. But that's part of what goes into just fighting during a pandemic. So we actually spend a lot of time with outdoor trailers and outdoor settings where we can screen and actually started treating patients with COVID symptoms. The first several months of the pandemic, as we moved further and further along, we saw patients coming in with fever, cough, shortness of breath. Some could barely speak, some could barely talk. And oftentimes they needed to have oxygen and other assistance. Now, as time has gone on, we've gotten more tools in this war against COVID to help us prepare and to face the challenges that we have. But COVID is not going hasn't gone anywhere. I was really hopeful. I mean, I spent the last the last about 4 or 5 months working at one of the vaccine sites. I was a site leader for Kaiser, in charge of our physicians and working with our doctors to oversee vaccine reactions. So I remember going out to Six Flags vaccine site in early February when it was freezing cold and it was raining, and just seeing those cars pouring through and people getting vaccinated and being so happy about, wow, we can finally turn the corner. As we moved throughout the winter, we moved into the summer months, and we went through the cicadas. So we had cicadas flying everywhere
Right.
in the parking lot. But there still was that hope that we would get as many vaccinated as possible. But then as February went into March, into April, into May, the numbers of vaccinated started dropping down. So we were up to almost 5,000 per day, 5,000 vaccines per day that were being given. And then by the end of this time, we're down to like 100 per day. And so that was very upsetting because we had all this vaccine available and all these things we could give to people to give them the tools to help fight the pandemic. But the urgency or the need and the want to get vaccinated had dropped down until eventually the vaccine site closed down, as well as other sites across the country. So all the mass vaccine sites have kind of shut down because of demand. Really there weren't enough people that really wanted the vaccine at some point. So now we're in another phase of the pandemic. As I'm sure you're all aware, we've gone through all this time with all the cases that we've had, and now we're facing another variant, the Delta variant. Variants, which I've heard of a couple of different ways to explain variants of COVID. And one of the best things I've ever heard is thinking about it almost the virus like a tree. Imagine a tree growing in a backyard, and it's got all these branches. Each variant is like a separate branch that grows. Now, sometimes a branch, like in a real tree, the branches will die off and fall away. But there's some branches that grow and become main parts of the tree eventually. And a tree branch, as you guys all know, can kind of overcome. It can overcome the house. It can overcome a fence. It can do different things, and that's how these variants are. So one of the keys, in my opinion, to overcoming and getting through this pandemic is vaccination. whatever tools we have available to us, we have to use those tools because one of the things about this pandemic and about COVID is that, like I said before, it's not our friend. Another great analogy to think of COVID, which someone had told me, which I thought was excellent, was thinking of COVID, the pandemic or the SARS-CoV-2 virus, almost like a burglar. The reason that that's
Mm,
a good analogy is because, a burglar wants to kind of break into your house, which in this scenario would be your body, and it's
right.
looking for ways to get in. So if you wear a mask and you protect yourself, and that would be the same thing as locking your doors and closing doors, you have some protection
Mhm.
against this
Right.
burglar. Vaccination is almost like getting an alarm system. So if something does come, you actually get the vaccine to be prepared to fight the virus when it comes back later. But if you don't get vaccinated and you've never had the disease, then it's almost like leaving your doors open with no alarm, no protection, and just waiting for this burglar to come to your house. Now, like
Right.
any burglar, it may come in the house and it may just take
Mhm.
your CD player. Well, actually, I'm saying how old I am. No one has CD players anymore.
Right.
It may take one of your, it may just take your television or something minor, but it
Right.
also, you might be harmed. So if you don't get vaccinated, you don't
Mhm.
protect yourself by wearing a mask and doing these things, then you're open to that. And that's how it happens. Once the virus starts
Yeah.
replicating, and when there's large community spread, you have a whole bunch of these burglars just running around looking for ways to get into a place. So that's one of the analogies that I think was really helpful to think about this pandemic. Now, just to talk about a little bit more about the reason to get
Sure.
vaccinated, I had a couple points. Just to talk about the vaccines that are available. Currently in
Mhm.
the U.S., we have three vaccines that are available: Moderna, Pfizer, and Johnson and Johnson. Now, on the vaccine side I was at, we actually carried Pfizer, and we had some J&J near the end of our
Mhm.
time. But these, just to kind of also talk about some myths that exist with these vaccines, because that's part of it. A lot of it's also education and just myths.
Right.
We all hear them. We all hear different things. For example, when you get a vaccine, you're actually getting COVID, but that's not true. That's not what's happening. So with the two, we'll call them mRNA vaccines,
Mhm.
and that stands for messenger RNA vaccines. Pfizer and Moderna are those two, for example. They give your body's instructions on ways to fight the virus once you're exposed to it. So this, imagine the vaccine goes into your arm, is where we
Yeah.
normally give it in the deltoid. Once it
Right.
enters your arm, you get your vaccine. It's lipid coated, so then it goes into the muscle cells there, and then it tells your body or that those cells how to make these like kind of spike proteins that is very similar to what COVID-19 has. That's kind of like COVID-19's key to get into your
Mhm.
body and cause harm to you.
Right.
Now, once these are made, there's no live virus, and these cells, they are actually these mRNA. Once it's made, it never enters your nucleus of the cell. It's made in the cytoplasm, but then it goes to the outside, and then it will start making versions of itself, so that once you do get exposed to COVID-19, you have something that's there to fight for you. Okay,
Right.
the
Yeah.
Johnson virus is not. I'm sorry, the vaccine is not
Mhm.
an mRNA vaccine, but it's a viral vector vaccine. It doesn't contain any live virus, and it
Right.
uses harmless adenovirus to create spike proteins. So those are the vaccines that we have available to us. The reasons for vaccination, and just kind of go over a couple with you guys. Vaccines have been around for a long time. And I think of vaccines almost similar to the way you think about, exercise, diet. These are things that really make a difference. When I was in the military, to share some experiences with you, I was in Pakistan doing earthquake relief with my unit.
Mhm.
Built our hospital in the middle of Pakistan after a huge earthquake in 2005. And when I entered, the small city of Muzaffarabad, it was a place where they didn't have a lot of vaccines. So things like measles, mumps, rubella, all the ones that we take for granted that we get vaccinated with as kids were
Right.
present. And we
Mhm.
saw these things, they were all present. So that's when I was really awakened to the just how good a vaccine is, having a vaccine. So that's one of the things I want to share with you. And then also when it comes to other things, in our country, whether it's flu vaccine, HPV, there's a lot of different vaccines that we have. So these vaccines are important. The other thing is, even with things like influenza, it's important to realize that if we don't talk about COVID alone, just to get into the influenza or the flu vaccine, that,
Right.
each year there's a lot of morbidity and mortality caused from just the flu. People lose
Right.
time at work. They get very
Yeah.
sick. They make their family members sick, and it affects our society as a whole. It affects us as well. So these are vaccines that have been around for a long time. So I'm a big proponent of vaccines, for sure. Your family, your coworkers, those are the other things, that you want to make sure that you're protecting those people. Just to kind of go over some more of the myths about the vaccine and about COVID. Um, let me well, actually let me just back up for a second here. I didn't want to go too fast. Yeah, there's so
No,
much I
no,
want to
it's
share with
a,
you guys, so I
I
get a little
know it's a
excited.
lot of great information, and I really love how you are pulling in um, the history of vaccinations and how we've been doing this for so long. In that, when we're talking about measles and mumps, we're like, oh my goodness, we don't see that anymore. We don't see it anymore because of vaccinations.
That's
And
right.
we need to think of it the same way for COVID-19. And
That's right.
I love how you pulled that together. Thank you so much for that.
Oh, sure, sure, sure.
Yeah.
And then to talk about, one of the things I've heard from people, they say, "Oh, COVID is just like the flu." Well,
Right.
I've seen both the flu, influenza, and I've seen COVID, and there's a lot of differences. For one, SARS-CoV-2, which is the virus that causes COVID-19,
Right.
can tend to make you a lot sicker than you get with influenza. Loss of taste and smell, some of the
Hmm.
complications that occur later on from COVID-19, you don't see with influenza. The length of time that it takes for you to get sick and infected is also different. And then the
Hmm.
symptoms, can tend to be a lot different as well. So there's a big difference. The patients that I know that have had both of influenza and COVID say that it's nothing like influenza at all. And my
Right.
experience working in the urgent care with patients that have COVID and watch them, the ones that are more ill, struggle to breathe, and just feeling so miserable. It's not like that.
Right.
So it is one that definitely can make you a lot sicker. It's already caused more deaths, and morbidity than influenza has. But like influenza, we now have a vaccine that we can get to help us. And then even with influenza, there's a lot of us that don't get influenza vaccines. You know, so this is just something to think about. And
Yeah.
and it's very important to use whatever you can to protect yourself. Let me see. Let's go over some more myths. Well, the other myth is about masks. Some people say that oh, masks don't help. Masks aren't useful. Well, I can tell you firsthand, the whole pandemic. The way we
Mhm.
survived in my system and all over the country, healthcare providers was by wearing masks, washing our hands, using social distance. At times when we were around patients, we had gowns. So our PPE is what kept us alive. It's what allowed us to survive. There were
Yeah.
days I came home from work, after working through the pandemic. I didn't know if I was infected or not. That was part of what was happening. You never
Yeah.
knew for sure if you were infected. You did your best. You would
Right.
see your patients, you would change your gown, you would change your gloves, you would wash your hands as long as you're supposed to, but you never really knew.
Yeah.
But, masks do make a large difference, especially when there's high community spread like we have right now.
Yeah.
Now, a little bit about the variants. You guys, I talked about the branches of a tree and how to kind of relate to those. There's several that have been talked about and discussed. There's the alpha variant, which came from United Kingdom. That's
Okay.
B117. The beta variant B1351 from South
Wow.
Africa. The
Yeah.
gamma variant P1, and that's from Japan and Brazil. And the delta was first identified in India. And then
Okay.
there's also talk about the lambda variant as well.
Yeah.
Now, what makes Delta so worrisome is that Delta is more
Mhm.
contagious than the other variants, and that's
Okay.
why it's kind of risen to the top, and
Yeah.
that's why it's kind of enemy number one right now.
Right.
Because for one, there's a term called R naught, which tells you how infectious a pathogen is.
Okay.
With the early COVID variants, the R naught was like 2. That means one person can infect 2 other people. That's what R naught
Mm.
represents. Delta
Wow.
has a R naught of, like they said, close to 8 to 9. So that means one person can infect up to 8 other people. And the incubation period seems to be a little shorter than it is with some of the other variants as well. So that
Okay.
means we can have more spread much quicker than we've had previously, and that's why we went from doing great to having surges and throughout the country. If
Right.
that makes sense.
That
Uh, were there any questions before I kept moving on too much further?
right.
Anybody have any
Yeah.
questions?
Any questions from our attendees? Please don't hesitate to ask any, put questions in the Q&A, and we will definitely get to them. So far there's no open questions. So
Okay.
I'm taking it as you are nailing all the talking points, and you're covered it, and people are engaged, and let's continue.
Yeah.
I really think one of the biggest, people get pretty confused about the is there, you see some? Okay, hold on one second. We do have, okay, very good. That's a good one. What advice would you give for parents who have kids returning to school in the fall? Recommendations, precautions. So
Okay.
that's one question.
That is a great question, because as I mentioned, I'm a parent myself.
Right.
And, this last year, my kids were pretty much virtual the whole year. So I would say that for kids returning to school, the most important thing I believe is masks. I mean, I believe that kids can return to school, because as much as I enjoyed some of the virtual learning at home, I'm ready
Right.
for my kids to go to school. But I think that, by teaching the
Same.
kids to, yeah, you feel the same, I'm sure.
Ready for
But
them. Go back.
yeah, but I mean, the schools will have to do a good job of social distance. They'll have to
Right.
limit the number of students in classrooms. They'll have to be really vigilant about hand washing and mask wearing. But I believe masks are part of that. You got to have that barrier protection that's first and foremost. The kids have to have masks.
Right.
And then they have to just be as cautious as possible. But I'm hoping that maybe it's just wishful thinking, but I'm really prayerful and hopeful, God willing, that our kids can return. But I think that wearing masks, especially indoors and in school, is going to be very important for all school-age children. And I know that's hard for parents. Masks. I can tell you, I know I wear masks every day,
Every day.
and it's hot. Walking from the parking lot to the inside when it's 93 degrees with a mask on is not fun. But I believe it's very essential to us having a safe return for the kids in school. That would be one thing that I say. And then the other thing I'm going to add to that is vaccination. I mean, I'm a big proponent of vaccination, and I know that's a tough one for a lot of parents. Currently, we're vaccinating 12 to 16-year-olds, and when I was at Six Flags working there, with Kaiser and for the Maryland Department of Health, I was nervous about that. I was worried about that age group initially, but that group did fine. I mean, they actually did it better than the adults when it came to reactions, when it came to anxiety. So I believe that in order for us to get through this, we're going to have to get as many people vaccinated as possible for us to get through this. So I believe in those two things: vaccination, as well as masks.
Wonderful. Thank you so much. Was there another? Did we have another question in the panel? No. Okay. So we can continue on. I would definitely. Can we talk about a little bit what do you recommend for our kids who are going back and are stressed out, or parents who are stressed out? What would you recommend for how can we talk to our kids and get them to understand what COVID-19 is and why they need to wear a mask and wash their hands and doing all these things, and also getting a vaccination. Like, I know my children do not like getting shots at all, but
Sure.
we do know that they're imperative for our survival. What's the best way for us to go about this conversation with them?
Well, I think one of the things that I use with my kids, which seems to work very well, is just honesty. Letting them understand where we are in the pandemic. Because this is something that we're going through now, and God willing, our kids won't have to deal with other pandemics. But the reality is they may have to. So unfortunately, I believe just preparing them, letting them know where we stand, trying to find a way to explain it to them that they understand. That's why I really like the burglar analogy. Because it seemed to really make sense in a lot of ways, and I think the more they can understand that, and then also just getting them to understand what's happening not only in our communities, but in our states, in our regions, and also globally. So when they can see the effect that this is having on everything, it puts it all in
Right.
perspective. Now, I'm a big proponent of kids doing as much as they can. For example, this summer my kids have been very active. We've been doing a lot of outdoor activities. I'm trying to let them do as much as they can, realizing that there might become a time when that's not possible. You don't know what's going
Yeah.
to happen in the future. Uh, but I think preparation and just understanding and just letting them understand where we are will help their anxiety, especially with the tools we have, because, God's given us tools. We have tools to protect ourselves.
True.
And so it's all about using those tools effectively. You know, Being in the military, I was given various tools and various things to help me survive and take care of myself when I was on mission somewhere. And I learned to use
Hmm.
those tools. So we have to use the tools we have.
Right.
That's very important.
I love it. That is I've been saying that to um the my to the audience that we encounter right on a regular basis. We reach out to a lot of clergy and letting them know that this is a tool. Vaccination is a tool. Masks are a tool. God has blessed us with this amazing science to protect us. So thank you so much for
Yeah.
just emphasizing that. I appreciate it.
One other
Um,
thing I was going to add to that too, Janae,
yeah.
which is
Yo,
also
yeah,
very important,
please.
is don't forget to take this time to amplify and recognize all the pandemic heroes. Because I spend a lot of time
Yeah.
with my kids just going through the heroes of this pandemic.
Right.
Well, healthcare workers, of course. Healthcare worker, nurses, techs, X-ray techs, physicians, people that work in the lab, and all of in throughout the hospital, but then also housekeepers, sanitation
Yeah.
workers, UPS drivers,
Yeah.
people that work for Metro,
Yeah.
policemen. These are all heroes as well, because they've had to be out there on the front line even
Mhm.
without any protection other than just other than masks, which can be
Right.
helpful, but
Yeah.
before there was a vaccine. So I spend a lot of time recognizing those. And I see those housekeepers where work in my where we're at, the EVS workers. I mean, they go in the rooms and they turn the rooms over and they get rooms ready for other patients. And they're doing this
Yeah.
all the time. Those sanitation workers who could drive up, up and down the street, they've been doing this since the beginning too. So I spend a lot of time on recognizing real life supermen and superwomen who are out there every day.
That's wonderful. You're absolutely right. And our essential workers are the backbone of our society, and we take them for granted quite often, on a regular basis. So thank you for that. I know we probably have some wonderful people on, watching in our audience right now who are essential workers. So thank you for all you do. We appreciate what you've been doing, and don't think that we don't appreciate, we don't understand or emphasize with what you're dealing with. So thank you.
That's
Um,
right. Yeah, I like to say thank you as well, because I mean, without you, this would be possible. And and you were doing it, even in times when we didn't have the extra protection. So,
yeah,
thank you. And a lot of those essential workers got sick. They got
I
sick
know.
early in the pandemic, and some of them are still fighting COVID and other things. So, definitely want to recognize those people.
Absolutely. So I have a question for you.
Sure.
Do you think in the near future, um, well, if is there a timeline for younger kids to get vaccinated? So kids under 12, um, do we know anything about that, or is that it's up to the CDC, of course, right?
Yeah, well, at this point, I know that they're working on that. I mean,
Right.
each day something changes. Like I know it sounds like just yesterday, they went ahead and they're approving, saying basically pregnant women, those who are nursing,
Yes.
that's something that just came out. They're looking at the need. Do we need to have a third dose or a booster dose? That's going to happen in the next couple of days. So there are a lot of things that are happening. And I think we're trying to just, move as quickly as we can, with that. But, but there's still a lot of people who are eligible, and that's the thing that to me that's sometimes frustrating, is that there's a lot of people that could get vaccinated that just don't, for whatever
Yeah.
reason. I've heard about natural immunity, like, if I had COVID, I don't need a vaccine. And I'll just talk about that real quick too, because the only thing about
Please
natural
do.
immunity is that, you don't know for sure how long that's going to last. That's part of the
Mm,
problem. It's not really guaranteed. And then again, it goes back to the analogy about the burglar. To get natural immunity, you gotta let the burglar's gotta break into your house. He's
yeah.
going to come in there. You don't know what it's going to do. You may be fine. You may not be fine. You might be fine, but then your mother or father or uncle might get really
Mm,
sick. So it's a dangerous way to try to navigate the pandemic. So that's the thing. But I really hope that we can move forward, and that we can get to a point where we have it available to the children. But we just really have to work on trying to get as many people that right now are eligible vaccinated, because Delta variant, the thing about Delta is so contagious that it's finding a lot of people, you know,
Mhm.
and so we really have to kind of work on improving that.
Right. Thank you. You're absolutely right. You know, I know I think if we touched on it a little bit, but I know people are still really concerned about the side effects of the vaccination. Can you talk about like what are the normal side effects of getting vaccinated and compare the side effects of the vaccination to the actually get contracting COVID-19?
Sure, sure.
Good. Yeah.
Well, when I worked this spring at the vaccine site, we were doing almost 5,000 vaccines per day. We
Yeah.
celebrated when we reached 250,000 vaccines
Ooh.
given, and once we got to 350,000, that's about when we stopped. But so I was out there, watching vaccine reactions, in cold weather, from
Right.
from my little cart to hot weather,
Mhm.
and there were some reactions. There were maybe a few hundred, mostly minor reactions. A lot of it was more anxiety related, but there's some people that had chills, some people that had arm pain, some people that had different types of reactions. But by
Right.
and large, those reactions were still very mild compared to what it actually means to get COVID-19.
Right.
I have family members, even my family members, before the vaccine was available, because I spent so much time with the disease process. When they call me and say, "Hey, Eric, I'm positive for COVID," and I say, "Okay, what day is it?" He said, "Okay, I've had symptoms for like 2 days." I say, "Okay,
Mm.
my cousin, day 10 is going to be the worst. So you let me know how you're doing by day 10. If you're having
Right.
any cough or anything, here's a pulse oximeter. Get one from
Mhm.
the CVS pharmacy,
Right.
get an incentive spirometer to help with your breathing, and let me know how you're doing. If your saturation is below 94%, then I start getting more concerned. Below 90%, you should go to the hospital."
Right.
So those conversations are very challenging, and you don't want to have those conversations, because if you start having problems breathing, you could end up on a ventilator, and you
Yeah.
could end up not surviving,
Absolutely.
because the effect that COVID has on the lungs. That's one of the things that I would say. So that's part of what you experience. So the side effects from the vaccine are mild compared to what actually it's like to ride through COVID-19. And it is like a ride. It's almost like a
Mm.
amusement park. When it's day one, you have these symptoms, and usually the ride lasts for 10 to 14 days. And,
Right.
and day 10 is the worst. Now with the Delta variant, it's supposed to even last a little longer, is what I'm understanding, that we're starting to
Wow.
learn now.
Mhm.
But you have to just get through. Now, some people get through in 5 days or 6 days, but most people by day 10, that's usually the worst time. And so you got to
Mm.
wait for days to see how you're going to do. And that's just not a position you want to be in.
Right.
One more thing I was going to add too, which is very
Yes,
important.
please.
The other reason that vaccine is so important is that if we don't have any vaccines, and we let the Delta variant or COVID just run wild, what happens is eventually there's so much community spread and there's so many cases
Yeah.
that you overwhelm the healthcare system. So,
Mm.
so here's what that means. Here's what that looks like for people to understand. If you ever
Yes,
saw, I'm
please.
sure we saw New York, we saw India, in
Yeah.
situations where there's so much spread, there's so much disease, people that need normal procedures. If you're having a heart attack, and you need to go to the emergency room or somewhere else, there's not any room to bring you inside because of so much acuity from the pandemic. And
Mm.
so at some point, you
Mm.
start looking at, that's why they look at ICU beds and hospital
Right.
beds, because once beds are full with a lot of other disease processes, and especially COVID, then you don't have any available beds. That's why you watch the news, you see in some of the states in the South, they're having a difficult time with ICU beds and hospital beds. And that's a position that
Yeah.
you don't want to be in. So, and also the other thing to mention, for us to get what they call herd immunity, you need to have like 75% of the population infected. So that would be like 8 times what we have now, like 200 million people.
Mm.
And for that to occur, there would be millions of deaths. So it would be so much hurt and pain that, that's not any way to go. And the other problem is, even with that happening, there's no guarantee that the immunity is going to last.
Yeah.
You may have to go through the pandemic again in the next year or the year after that, all over again. So that's part of the reason that, vaccines are the safest way for us to navigate this pandemic.
Right. Thank you so much for that. touching on, telling us about just how we might overwhelm our healthcare system is vital. Where, I think about how in the beginning we ended up really, like you said, overwhelming our hospitals to the point where people couldn't go in for to get for breast care exams, right? And they had to push that off because they were just too overwhelmed. They were keeping that they're in the waiting rooms that, and we couldn't risk further exposure. So I think about it that way, and how we have people that are putting off vital appointments because we have a pandemic that is going on. And when you think about the vaccination, is not just about you, it's about your community, it's about your city, it's about people that you don't know that are now at risk because for other things, it's a ripple effect, right? So now, someone that would have gone and gotten their breast exam might have pushed it off to next year when they didn't need to. So
Right. And we see that people that have high blood pressure and diabetes, because their diabetes was uncontrolled. Now they have complications from that, same thing
absolutely.
with kidney disease, people that, didn't have a chance to get things checked and to have all the screenings, there's all these things that we're finding, because we can't really do the preventative care that we need to do to function,
Absolutely.
that we really deserve as society. Exactly.
Perfect. Thank you so much.
Sure.
Can we talk about really quick, just who is really at risk? Clearly everyone's at risk for to get COVID, right? But who gets affected like more than others, if that makes sense.
Well, historically, with the pandemic, people that have pre-existing conditions, people that are on dialysis, people that have high blood pressure and diabetes, who have COPD or asthma, those are the ones who historically were being affected. But now with this Delta variant, what's interesting, because a lot of those patients or people are vaccinated, it's younger people. So there's younger people that are affected now. That's different than doing the first time around. So that's part of it. And the other thing about a vaccine, which I want to mention to everyone, is that these variants are always changing. The longer we play with this thing, we let this thing just kind of, continue to spread, then the more variants we have to deal with. And one day we might get a variant that's even worse than what we have now. So that's the other thing that's hard to predict. So we really need to try to squash this and be done with this fight, now, if we can. If we can get people vaccinated and get through this part, we can avoid having these other variants surface later on. But you're right. It was those patients who had more comorbidities, but now we're seeing
Younger
younger
people.
patients.
Perfect. Thank you for letting. And so, knowing that the Delta variant is affecting our younger people goes perfectly with our theme about making sure we're safe, making sure our students are safe. So thank you so much for that. So, we're coming up on our time, but I really would love to be able to give people the opportunity to ask any questions that they might have. So again, please let us know if you have any questions. You can put them in the Q&A. We're also monitoring the Facebook Live. So if there's any questions there, please let me know. We're happy to answer anything that you want to throw at us. This is a very casual conversation. So no question is stupid. Just let us throw it at us. Let's see if we can help you get through this pandemic.
And one of the things I was going to mention today as well is that, there's a lot of kind of controversy or, between vaccinated and unvaccinated, and, people are, upset with the unvaccinated and that. I mean, I believe that, some of that talk and things like that, we need to kind of tone down, and we need to understand that some people, just information, the information that they've gotten, and the understanding. I live and breathe COVID every day. So when I go to work, I have to see it. Some people have not seen the more severe cases and forms. Some people have their own opinions, but the key is that we work through this together, because I don't know about about you, but I want to get through this pandemic. I don't want to be
Right.
doing this. I don't want to wear a mask, be wearing masks 5 or 6 years from now,
Yeah.
working on this. I
Yeah.
want to get through this. And so I think the more we can educate people, the more we can just talk to among each other without any conflict or someone feeling bad or anything like that, the better off we all are.
Right. So, but what gives has I have a question related to that. So let's say our audience is chatting with an uncle or aunt someone, and they're like, oh, I'm not getting a vaccine. I'm not getting vaccinated. What do you recommend um, for our audience? What would be a great way to open that dialogue and not causing rift with family, because we know that we love our family members, but what is the best way to go about chatting with them, explain to them how important it is? I know the burglar was a good analogy, but what else could we use to really like hit it home with them?
Well, that's a great question. And that's the one that's very difficult because everyone
It is.
responds to different things.
Yeah.
But I do think that the more we just talk about the effects of just what it means not to have vaccines, and the more we talk about just that, hey, don't make people feel necessarily bad about it, but just
Right.
talk them through it, talk them through and say,
Hmm.
hey, this is something that millions of people have gotten, and try to break it down to something that they can relate to, whatever that is, whatever that analogy
Right.
may be. Then I think the better off you are, and then also just, the
Yeah.
fact is that we have to do this together. But those are difficult conversations. I had someone come and work on my something in my basement, and it turns out that we, oh, sorry,
No worries.
it turns out that there was someone that hadn't been vaccinated. So we
Right.
had a really good discussion,
Hmm.
and initially he didn't want to talk about it. I said, no, it's okay, let's just talk it out,
Yeah.
and by the end I think he understood my points, I understood what he was saying, but I
Hmm.
drove home a few of the points, about just about lasting immunity, about protection for yourself, for your family, and also I shared my experiences, because a lot of times a lot of people just don't understand what it's like, to see really sick patients. That's part of it too. I think that some people's world is so different, where they may be working virtually, they may not have anyone that's really gotten sick from COVID, they may not really understand the effects. It's something that's far off to them. But if you can
Right.
break it down to where it's like, hey, this is somebody that I know that had this, somebody that we both
Hmm.
know, then that makes a big difference.
Understood. Awesome. Thank you so much for that.
Sure.
So we have an anonymous attendee who asked, well, I guess she would love some reassurance. She's a healthcare worker, and she's worried about her child who is under 12 and wants to know, how can how can she be at ease when her child is going back to school? And I
Yeah.
Right.
Well, that's a great question, because that's me. I have three of those. I have three of those under 12. So I would say one of the most important things first off is to make sure that mom and dad are vaccinated. That's very important. Because then that way, by them coming home, the parents are vaccinated. And then number two is just really get those children comfortable with masks. Teach them how to wear the mask. Make sure they have more than one mask to bring with them when they go to school. I plan on having at least two or three for my kids, so if they lose one, they have another mask, and then explain to them why it's important to wear a mask. Teach them to wash your hands, make sure they have their own hand sanitizer if you can do that. So just
Mhm.
make them as prepared as possible, thinking, going back to like the warrior, they need to have all their tools. And so if right now
Yeah.
those warrior tools are a mask and some hand sanitizer and some soap,
Right.
use those
Yep.
tools effectively. I think that that's all very important, and even social distancing. Talk to them about that. My kids are young, so they like to get really close. But I always teach
Hmm.
them, okay, hey, listen, you're not, this is still too close. You need to stand back a little further. If you're talking to someone that you don't know, and so
Hmm.
just really spend a lot of time with those things, and then we have to see what happens. Once we get kids back to school, we'll see how well it goes, and we always can decide based on what's happening, in the school level. But those things are most important, I think, just getting them prepared.
I love it. That is exactly 100%. I have two kids. I have a 6-year-old and a 4-year-old, and they are
Mm.
pros at wearing a mask. My daughter,
Right.
So she's like, okay, I'm going outside, gotta put a mask on. She's nailing it. I think our kids are much more resilient than we give them, we take for granted and all that. We're the ones that are having difficulty with the change. The
Right.
kids, they're all right.
Yeah, that's true. Yeah, the kids will roll with it. For them, that's just part of what you do. So you're right. I mean, and that's the thing about it, because it's a reality. I mean, that's the biggest
Yes,
thing is I want to make sure my kids are anchored in reality of what's really going on and what's happening,
absolutely.
and then find ways to, as much as you can. I mean, we do a lot of virtual things.
Hmm.
My kids, they
Yeah,
do martial arts virtually a lot of times now, and then, we have chess. I mean, so we do a lot of things virtually. So
cool.
just find what you can do
Yeah.
virtually, and what things you can do in person or outside. You have to
Hmm.
just be as creative as possible. I mean, I've done more biking with my kids than I have in a long time, fishing. So just trying to find ways to.
Yeah,
Tennis is great. These are all
it's a
things and
good one.
activities that we can do to keep our kids going and keep them motivated, and just try our best that way.
Perfect. That's beautiful. And I'm going to let people know where they can find more information if they want to go ahead and get vaccinated. You can go to vaccinate.virginia.gov to find out your local area where you can get vaccinated, or you can call 1-877 VAX in VA, and there's a Spanish option. So when you dial in, you'll get the Spanish translation. And also just letting people know that this webinar is being recorded and will be showcased on Northern Virginia Family Service website at nvfs.org. And so we're coming up, on our time. And I just wanted to ask Dr. McDonald, do you have any last thoughts and advice for us?
Well, the last thing I would say is thank you for the time, and
Thank
everyone, please
you.
hang in there. I know it's very difficult because we've been doing this for a long time. A lot of us are tired. I'm tired of wearing masks. I'm tired of that. But now's the time when we have to just stay vigilant. Use the tools that we have, that are available to us now, and just think about our fellow man. You know what I'm saying? Think about each other. Think about our community,
Absolutely.
our families, and so we have to bond together. Because this
Bring us
SARS-CoV-2
together.
virus, like I always say, it's not our friend. It's like that burglar who's trying to break in and trying to find entrances and ways to get into to us. So we have to just work together and use the tools that we have available.
Awesome. Thank you so much. So I am going to start a poll real quick for our attendees. Please answer it. It's anonymous. Just want to know if you have learned anything new. So go ahead and participate in our poll. And it's like I said, it's anonymous, so no one will you're not going to get graded. there's no
Right.
there's no right or wrong answer. So also uh, keep in keep attuned to our website, Northern Virginia Family Service. We will be having more town halls in the future, and maybe Dr. McDonald might join for another one. We'll see how it goes. But we'll have every month we'll be doing a new topic. So this month is about our back to school, and we're going to have another one later this month, August 25th, the same time, 7 p.m. It'll be completely in Spanish, so that will be wonderful with Dr. Fabian Sandoval. He was one of our first guests, and then the month after that, we'll be talking about um, getting back to work as you're seeing organizations looking towards opening their offices again. So how can we be equipped to be prepared for that? Then the month after that, we'll be talking about what's next, right? So are we going to have to get the booster? We'll find out. Stay tuned. And the month after that, we'll be talking about making sure that we're staying safe with COVID-19 and the flu. making sure that we're staying on top of being vaccinated. So that is it. I appreciate everyone for coming in and staying with us for 50 minutes of really wonderful conversation with Dr. Eric McDonald. I have to say thank you again. I truly appreciate you
Sure.
giving us your time. I know you're busy and working in the ER, and the fact that you were able to give us some of your time is truly appreciative. We truly appreciate
Sure.
it. So thank you.
No problem. No problem. It's my pleasure. Please let me know if you ever want me to come back again,
Yeah.
definitely it's something we have to keep in touch. And yeah, I mean, this is something that we're all working through together. And the last little thing I would say is that just document your journey. That's one of the things I'm getting my kids to do is try to document their
Mhm.
experiences, their journey, and just find creative ways to do that so that that way years from now you have something to look back on and to say, okay, this is kind of what we went through, and what can we learn for the future. That's part of it, because one day our children's children will have to face something else, and so
Sure.
we want to make sure that we can pass on all the knowledge we learned so that the next generation is ready for the fight that may come for them.
Absolutely. I love that. Thank you so much.
Thank you so
Um,
much.
take care, sir.
Take care.